Thank you so much for joining us today. We are grateful today to be joined by Juliane Rohr, an emergency department nurse and also a sexual assault nurse examiner. Thank you so much for making some time for us today.
Thank you, yeah.
Yeah, part of the reason we brought you in is because April is Sexual Assault Awareness Month, and we want to make sure that people fully understand what the resources are in our community. I don't think everyone knows what a sexual assault nurse examiner or a S.A.N.E. is, so can you kind of start by just describing what you do?
Yeah, it's just a nurse that has some additional education and training around the exam process when somebody has been sexually assaulted, such as principles of like evidence collection and documentation.
Mm-hmm. And I think something that is so important is all of your work is so trauma informed. Like you're very thoughtful about the experience of the patient that you're working with. Can you kind of talk to me about that?
Yeah, that's kind of what a lot of the additional education and training focuses on is that trauma-informed care that you provide, how you interact with the patient, the choices you give them, and that level of comfort that you try to provide during that exam.
Yeah. I think some of the reason that maybe folks are concerned about coming forward or unsure about coming forward if something like this has happened to them is because they don't know what the process looks like, and sometimes that uncertainty is kind of scary. Mm-hmm. Can you kind of walk through what someone would expect if they did go to a place like Providence to report?
They would present to the emergency department where they'd kind of be triaged. We would get kind of a brief chief complaint from them and not really try to go into much detail. Then we'd get them kind of back to a room as quickly as we could, have a S.A.N.E. nurse come and speak with them and talk to them about their options, what we can offer them. They'll always have a medical examination and be seen by a medical provider in the ER, but there's other things we can provide them like medications, and they have reporting options, kind of who they would like to talk to, and we can also get them connected with advocacy support there in the emergency department.
And just because they come in doesn't mean that they necessarily have to report, right? It just gives them that option moving forward.
Yeah, as long as they are an adult, we're still mandatory reporters, so that wouldn't apply to children or vulnerable adults. But if you're an adult and you present, you can still have a kit collected and kind of see how you feel about it. You can report later. It's not uncommon for somebody to kind of not really know what they want to do, and so maybe they still want to have the evidence collected. It would be stored, and then they could choose to report at a later time or at the time of the exam as well, whatever they feel comfortable with.
And obviously every scenario is so different, but the sooner you can come in, kind of the stronger the evidence could be if you make the decision to report at some point.
Yeah, we usually have kind of a 5-day window is when we primarily would like to kind of capture that evidence. That's not kind of a hard and fast rule. There's extenuating circumstances if somebody's homeless or bedbound, but that's kind of the general rule of thumb is 5 days or 120 hours. You can still present to the emergency department, still have all that medical care, even if you're outside those 5 days. So that's just when we are going to be most likely to collect that evidence with the swabs.
5 days is a longer window than I would have expected. I would have thought it was shorter, so that gives people even more time.
Yeah, it gives them a good amount of time, and then the 5 days also kind of has to do with the medications we can offer and those time frame windows when we would want to start those medications. So that kind of all rolls it into generally around 5 days.
Yeah. How long have you been doing this kind of work?
I've been doing this since 2016, since I became an ER nurse, but then a couple years later, just wanting to feel better prepared for this exam, then I kind of started doing them more and getting like additional training and education.
I know there's a lot going on when you're an ER nurse. There's a lot that you're dealing with at all times. Why is this something that was important to you to get this certification and to do this kind of work as well?
I just think it's one of those patients that you may not see every day. It's not going to be as common as a chest pain patient, so being able to keep those skills current and feel like you can offer them the appropriate care, the trauma-informed care, and then you can also make sure that they have a sound exam that can withstand, kind of strict scrutiny if that was something that they wanted to use within the legal process. So just making sure that it's done correctly, and it's kind of an intimidating exam to do at first, and you just kind of want to learn more about it so you can better kind of provide that care for them.
Yeah. It's obviously an extremely difficult moment when someone comes in and needs a S.A.N.E. exam. What does it mean to you to be able to be the person to provide that care and that support in such a difficult moment for people in our community?
It's really important. I think it's also a time where you can kind of slow down and be one-on-one with a patient, and they really do need that kind of more one-on-one care. It's helpful just to be able to know the process. You can answer all their questions. There's a lot of information we're kind of throwing at people, and knowing how the process works, and you can better kind of make them feel at ease and at rest and kind of give them that control back when you're doing the exam.
Yeah, I think that that's such a great point, being able to give them kind of agency again after something so difficult. What's a message that you have for people in our community, if this does happen to them and they're kind of afraid to come in, as someone who would be the person, one of the people that they might encounter, what's a message you have?
I think it's important for them to know that there's nothing that they have to do, that they have those options, and also just knowing that there is a lot of support between medical professionals and advocacy in the community where people can really help them and walk them through each step and make sure that we're only doing what they feel comfortable with.
Yeah. Is there anything I haven't asked you that you want to make sure people know?
I don't think so at this moment.
Okay. Well, thank you so much, Juliane. We really appreciate your time today.
Yeah, thank you.